and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heienck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I like your get up here today, Brad.
Yeah, what do you think?
Yeah.
Yeah, I used to use this for
Strong
running
like bull,
yeah,
huh?
when I was fast.
Okay.
Faster.
All right, well, today we're going to talk about the subscapularis.
Right. A couple of our viewers requested that we do something on subscapularis tendonitis.
And when you request, we actually follow up and do it.
Right. Well, we get quite a list, so it takes some
try
time.
sometimes.
Right. I don't want to say that for everyone because it's
don't.
tough. Okay, subscapularis tendonitis. So we need to know where the subscapularis muscle is, and it's way up in here. What it does, that muscle is responsible. It's one of the rotator cuff muscles, and it moves your arm in like this. When you have pain in your shoulder, you may not have it where the muscle is. There may be a referred pain. You may feel it more on this side of the muscle or on this side of the shoulder or in front. This is something you can do to yourself, by yourself. There's no negative response. It may not help, but if it does, you're in good shape.
You want to show on here too, Brad?
You
maybe?
bet. So, Lonnie, can you get...
Why don't you come to her?
Yeah. Come on.
So that's the shoulder blade.
Here is the scapula. This is the subscapularis. It's the muscle right in here.
So here's the shoulder blade with the muscles on it. So if we pulled this off, here are the muscles inside that fill in that little scoop.
Yeah,
You know.
right in there.
So here's the back side. That has muscles too, but the subscapularis is the muscle that comes up and attaches to the humerus and then turns it in.
Yep, makes the arm go in that way. Here, let's back up again once. Okay, so we've got to get to this muscle. We're going to do a little soft tissue work.
Okay.
Kind of like a cross-friction massage. We've done a lot of videos on that. But how do you get back up in there? It's pretty easy on the skeleton here. I can just get in here, but this is a big deal. There's a lot of soft tissue around here. So you cannot do it by yourself with your right arm if it's on the right side. You can do it with the other arm. So I'm just going to, can you hold this arm up,
Sure.
Bob? You're going to get that arm out of the way, and you're going to use your thumb, and you're going to get right up in there with your other arm, and then you get on that muscle, and you give it that massage. This is not an easy thing to do, but you can do it, okay?
Okay.
That's why I'm wearing my Strong Like Bull shirt.
Okay.
All right, so I'm going to take this hand over here to get that arm out of the way, and I need to get up into your armpit, the axillary region we call it, and you're going to work your thumb up in there, and you're going to try and find that tender spot, and when you find it, you're going to work. Now, you really can't see what I'm doing, but I'm
Are you going up and down, Brad?
up and down.
Because he's going across the fiber.
Right, yep.
Yeah.
And you're going to work, oh, there we go. Again, this is going to take some practice, and you may, there I'm deep, I'm a little deeper on the backside, inside of that shoulder blade. Yeah, you can.
You know, one thing, Brad, so he's working on this area right here, Lonnie.
Right.
And actually, quite often, you probably want to work more almost on the tendon, because that's where the tendonitis is.
Right.
So he's going to rub across the tendon here, break up that scar tissue probably, there's some there. Now, you can work the muscle too, because that'll stretch it out.
Sure.
But he's going to work on where the tendon actually attaches to the humerus, and he's going to do some cross fiber. And again, by breaking up the scar tissue, hopefully it'll give you less pain.
Yep, better range of motion. You'll find this arm has to be completely relaxed. If you're tense here, you're not going to get through that lat muscle is going to tighten down. You're not going to get in there. So you really need to work on relaxing. And you may even have, if you had a table or something, Bob, here, just stand right there. No, that's not going to work. I can relax, but some people, if you're new at this, you might tighten and you're not going to get in there. You really get this to relax. And I can get in there. I'm right on the back side of that.
Oh yeah, I'm in there.
Yeah. Yeah, it takes a little practice.
Oh, and I'm right on the tendon. I can feel it.
Yeah. It's going to be a little painful when you get on it, just like any cross-friction massage, but you're going to work it for about 30 seconds. The pain should reduce or start to feel like a numbness or tingling. And when you're done, you're going to feel it's going to be a little bit looser. There's one more thing I'm going to add, a stretch, because remember this muscle pulls in, internal rotator. So you can go up to the wall, put your hand here, and do a gentle stretch going out this way, just like I'm doing here. You might use a different height depending on how it feels. It should feel like a good stretch. If you do this, you know, Bob, and it's like, ow, it hurts.
Right.
Leave it alone. Just
Yeah.
stick with the massage. Okay. So
Sounds
that's
good,
it.
Brad.
Yeah.
A little gross, but sounds good.
What? Well, you got to get into the armpit. Yeah. Clean. Do it after a shower. I don't know.
All right.
Take
Thanks
care.
for watching.